இந்த குரூப்ஸ் எடுக்கலாம் இது கரெக்டாக ப்ரொஜெக்ட் ஆகிடும்.
இந்த குரூப்ஸை கம்மி பண்ணணும், இது உள்ளே போகணும், இது கொஞ்சம் ரைஸ் பண்ணணும்.
இந்த இடம் பார்த்தீங்கன்னா இவ்வளோ ப்ராடாக இருக்குது, கொஞ்சம் விட்டு பாருங்கள்.
இந்த விட்டு கம்மி பண்ணலாம், ஆனால் இங்கே கரெக்டாக தான் இருக்குது.
இங்கே கரெக்டாக
ஆமாம் ஆமாம், இது கரெக்ட் பண்ணால் மேட்ச் ஆகும். இதை சரி பண்ணணும், ஒரு பல்லம் இருக்குது, அதை ரைஸ் பண்ணிடலாம். அப்போ உங்களுக்கு இந்த லைட் அங்கேருந்தே கரெக்டாக வந்துடும். டிப்பை லைட்டாக பண்ணுவோம், இங்கே கொஞ்சம் நம்ம ஃபீல் பண்ணுவோம். இந்த க்ளூ உங்களுக்கு வேண்டாம், ஒரு இன்ஸ்ட் மாதிரி இருக்குது. அது லைட்டாக சரி லைட்டாக கட் பண்ணணும். அது ரொம்ப ப்ராப்ளம் இல்லை, அதை சரி பண்ணுவாங்க. என்ன பண்ணுவாங்க உங்களுக்கு? பெரிய ப்ராப்ளமாக இல்லை, இந்த மெயின் இருக்கிறதுல. சரி, ஓகே. இன்னும் மேலே பண்ணுவா, கீழே பண்ணுவா? ஆமாம், லிஃப்ட் ஆகும். அது பார்க்குறேன், இன்னும் நினைக்கிறேன். ஸோ okay. So we are doing a revision rhinoplasty, not doing planning. She had a primary nose job elsewhere, and she has a few subtle points that we're going to look at and address. So one is the nose is pinched. She's got a small depression there because the grafting earlier doesn't extend all the way to the radix. So we'll have to work on that. And then you see there's an imbalance in the dorsal aesthetic line, so we're going to work on that. And the tip, she wants a little bit more projected and a little bit more de-rotated. So this angle is probably 110 degrees. We're going to make that 95 or so. And then a little bit on the width too, but I think that's really okay. This exaggerated growing is also something she's concerned about. So we will be taking care of that. So last time உங்களுக்கு ஒரு ஃப்ராக்சர் பண்ணாங்க தெரியுமா? மாஸ்டர் பண்ணியிருந்தாங்களா? இந்த இடத்துல நம்ம நெல் உடைக்கிறதுக்கு ஸ்டிச் தான் இருந்துச்சு. ஒன்றும் இல்லை. ஆமாம், அது இங்கே இருக்கு. இங்கே தான் இருக்காங்க சொல்லுங்கள். உட்காந்து சொல்லுங்கள். So osteotomy coming in there. So I think that means that the more the osteotomy is under in the width will come here. Will come here go. Every breathing issue is less.
Alright, so here we have a young patient with us who seeks a revision rhinoplasty surgery. I say revision because she's already undergone a primary rhinoplasty elsewhere, and now it's over. When was the last? In July last year, so it's almost now over 7 months that we are going to do a second rhinoplasty. The major reasons as to why we are doing a second procedure is because she is unhappy with the dorsal width. She finds it to be broad. Also the radix is depressed. That is one thing we are going to correct. And if you see these grovings right here, they're very prominent, they don't look aesthetic. So these are the three things. Also one thing more she mentioned was she wants a sharper tip. So all of this, the radix augmentation, dorsal augmentation, tip projection, and the marginal rim grafts, they are all going to require a rib grafting. So it's going to be a open structure septorhinoplasty with rib grafting. Also, do you have any breathing issues?
No.
Nothing. No blocked nose, nothing. So this is purely a cosmetic surgery, a secondary revision surgery that we are going to perform. It takes more time than the primary because there's a lot of scar tissue that we'll be encountering. Approximately 3 hours, and she had a few questions about anesthesia. How long does it take? That's a very common question asked by patients, but intubation, extubation is just maybe 10 to 15 minutes at the most, and you're out, so you don't have to worry. Are you nervous?
No, not that much.
Not that
Second
much.
surgery also.
Okay, so that's good. She already has an experience of anesthesia and how it works. So yeah, don't worry, you'll be fine. Alright, we'll show you the post-op results once the surgery is done. Thank you.
Put start like this. So we've just completed with this revision rhinoplasty. So you can see the improvement. We've done work on the radix, dorsum and the tip. We've narrowed the nose with an osteotomy. We've done alar base work. Also patient got in a few grafts. We'll show you how she looked before we started. So that was her. Yeah, so now you can see so you can see there's a lot of projection. Yes, we had to harvest rib, which went on the dorsum, the tip. No septoplasty. And that's the side view. So you can see the improvement. The tip was looking a little bit up, and we've corrected that now. We've de-rotated it. Alright, now some basal view. So that's the patient right now, and this was her before. Already removed and kept there. Huh? Hold on 1 second, Baba. Okay, now see. Call your dad. Is he around? He needs to see. வாங்க எப்படி இருக்கு பாருங்க நோஸ் சூப்பராக இருக்கா
நல்லா இருக்கு சார்
சரி அதான்
நல்லா இருக்கும்னு நான் அன்னைக்கு கூட சொல்கிறேன்.
ஆ
அது இருந்தாலும் டாக்டர் சொல்லணும்.
சூப்பராக இருக்குல்ல?
நல்லா இருக்குங்க சார்.
அது ரெண்டாவது பண்ணுறது எப்போவே டிஃபிகல்ட். இவங்க அந்த நேற்றுக்கு சொல்லிட்டு கேட்டுட்டு இருந்தாங்களே ஏதோ ஒரு இது, அது இங்கே வரைக்கும் தான் இருந்துச்சு. அப்புறம் டிப்ரெஷன் அதில் தான் ஒரு கிராஃப் வச்சு. ஸோ ஐம் ஜஸ்ட் டெல்லிங் தெம் தட் திஸ் வாஸ் அ ரிவிஷன் நோஸ் ஜாப்ஸ். ஹி ஹேட் அ பிரைமரி சர்ஜரி டன் 1 year ago, right? Almost a year ago. And now we've done the augmentation. We're going to show you also how she looked before we started. And but first up, so there was a depression here which we've corrected. So we've augmented from the radix. We've given her a nice tip. She had some asymmetry and it was very pinched earlier. So we widened that and we've given a nice tip. And yes, we had to harvest rib. Yeah, we're going to show you how she looked now before. Right? So yeah, she had a nice nose as it is, you might see, but you see there was a problem. There was a dip there, and that was the graft which was kept from the earlier surgery, which if you see carefully there's a slight dip kind of a thing here, but that's going to go away with time. Now I'm going to show you on this view. Show the side view, the side please. Now you can see, look at that now. So the side view is even better because the tip has come forwards. It's become much more pointier also. Okay, then where's the other view? Okay, now this one, and this is the side view. Okay, you can see. So if you look here, the side view, this angle was much more than what it's now. So we have rotated the nose a little bit, so this has gone in and this has come out, and then of course the tip also. And then we're going to show you the basal view. Where's the basal view? Do you have a basal view picture? Yeah, and look at this. There's a lot of improvement in this. So there's asymmetry that has been corrected. Nose, the alar relationship with the columella looks nicer. The columella has been made a little bit thinner, as you can see the width, and both of them are very symmetrical. So yeah, it's just few millimeters here and there, and rhinoplasty itself is just that. It's a surgery of millimeters. I keep saying this, and so we've, I think, made her happy with all of this. Or you're good? Yeah. All right. Yeah. So you still have to take care because we've taken off your splints earlier than normally also, right? One day. So take off every other suture today here and see how it is on the nose. And we've taken the her rib also for contouring, for the grafts, for reshaping this nose. Yes, right. These discolorations will disappear. The blue-black colorations. Yeah, that'll take about 3 weeks. All right. So you leaving today?
Yeah.
Cool.
Thank you, sir.
Happy then any year? Right.
I came to Richardsons for my revision rhinoplasty. I had a deviated septum and very broad tip. So now my surgery is done and I'm very happy with this. You can see that the angle and everything is very good. So here the stabs and the ambience and everything is good. If you are looking for any rhinoplasty or any such surgeries, please do visit Richardsons. So, thank you so much. Thank you. Okay. But you come back, when are you coming back? Monday. Okay. Yeah, come back and get the sutures. Don't delay later than